things like hurricanes are going to become more severe and more frequent. We mentioned my Puerto Rico study. We've had 2 add-on studies to that due to some of the fallout we're going to be seeing more of with climate change. So one was Hurricane Maria. We were in the middle of our cohort recruitment. We had 100 pregnant women at the time that hit. So we're looking at, with a colleague of mine, Deb Watkins, we're looking at what were the impacts of that from an exposure to environmental chemical standpoint, but also from a psychosocial and health impact standpoint. Another thing we had to deal with was the Zika outbreak. Infectious diseases, vector-borne diseases with more tropical, warmer weather are going to be more common in places where you didn't used to see them, and outbreaks potentially more difficult to control. So those are a couple of examples that just from doing my work anyway we've been seeing. But then you have rising sea levels, extreme weather, so a lot of people are going to be displaced, whether it's from extreme weather events. People are going to have to leave places below sea level or on the coast eventually. So then you're talking about migrant health, access to health care. In my area of research, maternal child health, people are moving around, being displaced. And all these things have downstream health implications. So at Public Health, we're trying to think about anticipating what those health effects are going to be, and then what can we do to be ready for them and to try to change the tide if we can. Michigan is just a great place to do research. It's extremely strong in so many areas. We have public health, we're very strong, but medicine, engineering, business, law, anything you need, social work. We're a very interdisciplinary school here at Public Health, so I can point to examples of virtually every other unit on campus that we're collaborating with. Undergrads to master's students to PhD students, all been very strong, very passionate, and they really want to make a difference in the world, and that's something that's really kept the research going as well.